In this video, we'll be discussing the clinical pearls of cortical cleaving hydrodissection. Hydrodissection is a very important but often underrated step of phacoemulsification surgery. Before going on to the video, we can discuss the signs of a good hydrodissection, starting with the first one, that is the complete posterior fluid wave, followed by anterior displacement of the nucleus and shallowing of the anterior chamber, leading to a smooth rotation of the nucleus following the hydrodissection. This is a slow motion video which describes a good hydrodissection. Before starting with hydrodissection, it is important to burp out a little bit of viscoelastic from the anterior chamber so that during hydrodissection there is no overinflation of the anterior chamber, and also there is enough space for the nucleus to move anteriorly. We have to take the hydrodissection cannula near the equator and push the fluid gently but firmly by tenting the anterior capsule. And we have to look at the posterior fluid wave. The posterior fluid wave should move from one end to the other and it should be complete. This signifies a good hydrodissection. Following which we will see shallowing of the anterior chamber due to the anterior movement of the nucleus. At this point, we have to stop any further injection of the fluid and we have to press the anteriorly displaced nucleus downwards to break any nuclear capsular block and also to allow the egress of the fluid into the anterior chamber and outside through the main port. Following which, we have to attempt to rotate the nucleus. We have to ensure that the nucleus is rotating smoothly and effortlessly before going on to the phaco. Here I am using my hydrocannula to rotate the nucleus, but we can use the Sinski hook for rotation through the side port. The cannula should be placed on the either side for injection of the fluid and never towards the opposite end. Now in this video we will see the common mistakes made by a beginner surgeon. The amount of fluid injected is not adequate and also hesitant injections are seen. So here we cannot see a complete posterior wave, and this leads to incomplete rotation of the nucleus as we can see here. So it is always advisable to repeat a proper hydrodissection in such cases. It's a good hydrodissection video in real time, starting with burping of the viscoelastic from the anterior chamber, taking the cannula near the equator, tenting up the anterior capsule, gently but firmly injecting the fluid, achieving a complete posterior fluid wave, decompressing the nucleus by pushing it down, allowing the entrapped fluid behind it to come out, achieving a good rotation before going on to phaco. Thank you.